Take a ball to the socket, and it's going to have a force that's going to blow out the rupture, the posterior bone casing of the eye. Your eye is going to drop in level because it's almost always going to rupture the floor of the socket, and so the globe itself is going to drop down. So you do tracking and something, and you're going to be right with that one. It's going to entrapment of the inferior rectus muscle, resulting in the inability to look down. There's a fat deposit usually seen on the CT scan through the floor. Now there's possible shards, so you're going to want to make sure that you do cover both eyes so they're not tracking and lacerating their globe on the shards of bone. Face, and we've got Dolan's lines, which you've seen. Nose.
Broken nose.
Broken nose. So this is cartilage through here. Now this junction right across the bridge, right up in here, frequently will be a point of complaint with pain because that's where the cartilage meets the bone. So you can actually stress that joint location and damage that. Usually that'll heal by itself. It's not too big of a deal. If you start crushing into the nasal passages into the sinus cavity, I think I told you about my baseball player who caught himself in his face. Maybe. Yeah, he looked a bit like this, but this entire area underneath was crushed in, and you really just couldn't tell. So I get them checked, make sure that you've got an ENT looking through and assessing the passageways internally to make sure that they're okay. Goalkeeper of mine got hit in the face, and you know your kids, and you know your players, and so I knew something was a bit wrong. You guys see, Mario from the Mario Brothers? That was our referee. I hated Mario. He's short little fat dude, that little Italian guy walking around. Couldn't stand him for the rep. So Mario, he never really left like more than 5 or 10 yards in the center circle when he left the game.
Oh my God.
So he was never where he needed to be. So I've got a girl at the far end of the field, and he's like at midfield, and she's down like this. And goalkeepers, for the most part, they're pretty beast. I mean, they intentionally throw themselves on the ground over and over and over. So she's down like this, you just know that something's not quite right. But in soccer, the ref has to invite you onto the field or there's lots of drama.
Yes.
And so Mario was waddling his way down to the field to the players. And he finally, I'm like pacing on the sidelines, like, let me on. I mean, just wait. No, seriously. And then by the time I get over there, I look at her and she's like, blood's covering her keeper gloves. I'm like, seriously? Now we got to clean those. I do a lot of humor to try to just. She looks at me. She's like, so is it broken? I'm like, I don't know. Is it always crooked? I didn't go over too well. So, nosebleeds management. Sports Cure is a powder that you can use. It's an instant clot powder. It burns like hell. They're always going to ask, is this going to hurt? And I'll say it won't hurt me a bit. So you're going to pour it on the wound and for any kind of open laceration, but you can put it on a Q-tip as well and get it up in the area and have it help. But you want to hold pressure on it at that point as well. The arteries that kind of cause nosebleeds kind of come up and through here for the lower part. So if you can hold pressure in through here as well as above the bridge, that's going to be your best bet to manage nosebleeds. Good to know that for your kids when you have them in the future too. And then a folded piece of gauze up under the lip also helps put pressure on the arteries in through here, which again helps shut the blood flow to the nose. Broken nose, stress frontonasal suture, or junction between the cartilage plate and the nasal bones. Isolated nasal fracture, no deviation of the septum. Any of those can be a problem. So effectively know your bones in the nose, and if it looks out of place and displaced, then get them to an ENT and let them deal with it. Yeah. Mandibular fractures, we can crack them in lots of different places, most commonly on the body or on the angle. So up and through here, and you start talking about people getting punched in the face, and you get a crack across here, which is going to hit the body or the inferior angle. The others aren't nearly as common, but they exist, and all of those are going to be surgical repairs for other people. So assessing this function up into the subcondylar location, which actually is the junction up in here, your TMJ, temporal mandibular joint. If you put gloves on your fingers and then just stick your finger in their ears and have them track their jaw, you can actually feel that joint cleanly. So you can assess the tracking of it, the palpation, and certainly the deformity or the dislocation, because those can all exist as well. Mandibular fracture, step deformity, positive tongue blade test. If you have a tongue blade, you have them bite down on it. They're not like that. Functional status, difficulty opening mouth, pain with biting down, possible maltracking, pain produced while stressing the mandible, as in like either lateral compression or having them bite to where there's compression on from the biting. TMJ dislocation exists, to where you're dislocating that mandible from the temporal bone. And still dislocated in spasm of masseter and temporal muscles can be felt, to where the masseter and through here are going to lock up, trying to splint it. All of these things are pretty much get them to the doctor and let them figure it out. And then ears are fun. Conductive hearing loss, where you end up having damage into the incus, the malleus, and the stapes in the ear. Sensory neural hearing loss, where there's damage in the brain, damage in the nerve, or conducting through the cortical connections. And then cauliflower ear. So cauliflower ear is lovely. This is actually where you've ruptured the cartilage in the ear, and it swells really big, and then it kind of just stays that way. So unless you get this, you've got to get the swelling out when those things happen. So you're going to put a pressure clamp on it. You can actually take some gauze and use a paper clip, one of those like big black plastic paper clip clamps. You can use those pretty easily. So pat it a little bit and then use one of those to kind of hold pressure if this has happened, because that's going to keep the pressure, keep the swelling out, which is going to keep the collagen formation and the thickening in here away. But that's why wrestlers wear headgears, to protect ears from this, because this will end up being hearing loss because it's cutting off the external auditory meatus.
Oh, wait a minute.
This can also, just so you know, happen to your dog. Dogs flip their ears and will whack it on a table and they'll bruise it. They can break the cartilage by doing that. Or just the process of whipping it can break the cartilage sometimes. I've had 2 dogs that have done this to where it's gotten big and fat, and they go in there and they put a port in there and it drains, and then your dog shakes its head and blood stows everywhere. It's unfortunate. Where's that? And more ways to die. Dude, for real people, it's just a head wound. Annie's not here because one of her football players is apparently trying to play soccer with cleats on, and he got like a huge gash across the head.